Hello, welcome to another post from Dr. Blake's Healing Soul. Today, Aphrodite, our athletic trainer, will show a patient who requests a simple way of taping her knee when she goes to work out to give her a little extra support and may protect her knee. Aphrodite will also show a more involved McConnell taping, which the patient would need to learn from a physical therapist.
Okay, so for the knee stabilization, I'm going to be using kinesio tape, which I find is the best one to use, but you can also use athletic tape, or you can use McConnell, which I'll be showing later, that involves the Leuko tape and the cover roll. So you always want to make sure the patient is in slight knee flexion, so I always roll up a towel, put it underneath the knee. So the first thing I want to do is measure around the kneecap. So in this case, we're going to be using 4 squares of kinesio tape.
And each square is about 2 inches.
Yeah, approximately. The tape long ways is also 2 inches, and for this technique I prefer to use the 3-inch tape, but we only have the 2-inch, so we're just going to have to modify it a little bit. With the 3-inch, you would actually, because it's wider, you can actually cut a slit through it and then take one piece and kind of go around the kneecap that way. But I'll show you the modified version with this. So what you want to do is you can either start below the kneecap or above the kneecap, and you basically want to just cup around it to keep it in place. Make sure you rub it so it sticks. And then one more strip. So you kind of cross over it. And again, cup around it. And just rub it, and that's it. So the purpose of it is to kind of keep the kneecap in place so that when you go to walk or run or exercise, you're decreasing the amount of pain in the knee. So it's supporting it with the tape. And then for the McConnell taping, which I'll show on this knee, what you want to do is, well, first I want to make sure that I'm taping it the correct way. So the most common one is actually a kneecap medial glide, so you would be taping inside. But some people actually already have too much of a medial glide. So when I test it, I ask them to do a squat, watch them go up or down stairs, and if I see that the kneecap's going in, then I actually tape it out. So in this case, I'll show you the medial glide. So what I want to do is use the cover roll first, which is just to protect the skin. So I just measure sideways this way around the kneecap. And I cut 2 strips.
And this is what a physical therapist would have, this material.
Yes, it's kind of hard to learn on your own. You can get it at medical supply stores, but it's best if someone instructs you first and then you do it by yourself at home. So this one you actually just lay down kind of lightly. You don't have to pull on it or anything. Again, it's just to protect the skin from the tape. So you just do one strip and then one directly over it.
And McConnell was a physical therapist in Australia?
I believe so. And here's the Leuko tape. So it's a pretty strong tape. So I measure again sideways, and when I measured this one, I'm going to be pulling it, so I don't want it to be the same length as the cover roll. I want it to be a little bit shorter. So
Is Leuko tape the strongest tape you've ever
yes, it is
used?
actually. And that's another reason why you want to protect your skin first, because if you put the leukotape directly on your skin, you can actually tear your skin off if you're not careful. So I start from the side of the knee cap, and I want to pull the kneecap in and then lay the tape down. And one more strip.
There's a little overlap.
Yes. That's it for that. So what it does is it pulls the kneecap in so that when they go to do stairs or a squat again, it'll decrease the pain because it's making sure that the knee stays in line as opposed to going out.
Right. And how long how long would these two taping methods work?
The kinesio tape is water resistant, which is nice because you can wear it in the shower and it'll stay on. So typically 3 to 5 days is the norm for the kinesio tape. For the McConnell taping, it's not water resistant, so I always tell the patient when they're done with their exercise for the day, take it off before they go to bed, and then reapply it again in the morning.
Great. Now, patient, can we have you walk with that and just see how you feel? So they're staying on really well. And do they feel comfortable to you?
Yes, you can definitely feel the extra support.
Great. Well, thank you very much, Aphrodite, for showing those two fairly standard knee taping methods.
You're welcome.